How do you maintain confidentiality in sensitive situations?
Maintaining confidentiality in sensitive situations is an absolute cornerstone of nursing practice, and something I approach with utmost seriousness and vigilance, guided by both ethical principles and legal requirements like HIPAA. My commitment is to protect patient information, ensuring their privacy and fostering trust, especially when dealing with delicate or stigmatized conditions. Practically, this means consistently adhering to strict protocols. I ensure all electronic health records are accessed only on a need-to-know basis, always logging out of systems when stepping away from a computer and using strong, unique passwords. Physical charts are never left open or unattended where unauthorized individuals could view them. Any discussions about patient care are conducted in private, secure areas, using a low voice, and never in public spaces like hallways or elevators. When speaking with family members, I meticulously verify their identity and ensure they are authorized contacts according to the patient's consent, referring them to the physician for detailed medical updates as appropriate. Furthermore, I am acutely aware of the dangers of discussing patient information in my personal life or on social media, treating all patient data, regardless of its perceived sensitivity, with the same level of discretion. In particularly sensitive cases, such as those involving mental health, domestic violence, or infectious diseases, I heighten my awareness, ensuring every interaction, every piece of documentation, and every conversation strictly adheres to these principles. It's an ongoing commitment to upholding patient dignity and trust through rigorous adherence to privacy standards.
What motivates you to work long shifts in high-stress environments?
What motivates me to work long shifts in high-stress environments is primarily the profound sense of purpose and the direct impact I can have on patients' lives. Knowing that my presence and skills directly contribute to someone's healing, comfort, or even survival, especially during critical moments, is incredibly fulfilling. There's a unique satisfaction that comes from navigating complex challenges, making swift decisions, and seeing a positive outcome as a result of dedicated teamwork. Additionally, I'm highly motivated by the camaraderie and shared commitment within a high-performing healthcare team. In high-stress situations, everyone is working towards a common goal, and the collective effort, support, and trust among colleagues are palpable. This sense of shared responsibility and mutual reliance makes even the most demanding shifts manageable and rewarding. Ultimately, the opportunity to make a tangible difference when it matters most, coupled with the strength derived from working alongside dedicated professionals, fuels my resilience and drive in challenging environments.
A patient refuses life-saving treatment due to religious beliefs. Your action?
When a patient refuses life-saving treatment due to religious beliefs, my first and most crucial action is to ensure their decision-making capacity. It's imperative to confirm that they are fully alert, oriented, and understand the consequences of their refusal, including the potential for serious harm or death. This involves assessing their cognitive status, ensuring they are not under duress, and that they comprehend the medical information being presented to them, even if they disagree with it. Once capacity is confirmed, my role shifts to respecting their autonomy while also ensuring they have all the necessary information. I would facilitate a conversation between the patient, their family, if the patient consents, and the medical team, including the physician, to clearly explain the diagnosis, the proposed treatment, its benefits, risks, and the prognosis both with and without the treatment. We would explore if there are any acceptable alternatives that align with their beliefs, or if there's any flexibility within their religious tenets. If the patient remains steadfast in their refusal after being fully informed and understanding the ramifications, it's my ethical responsibility to document their decision meticulously in the medical record. This includes documenting the assessment of their capacity, the detailed discussion of risks and benefits, the patient's expressed reasons for refusal, and their informed consent to refuse treatment. While it can be emotionally challenging to witness a patient refuse life-saving care, upholding their right to self-determination, once deemed competent, is paramount in patient-centered care.
You suspect a colleague is impaired on duty. How do you proceed?
Suspecting a colleague is impaired on duty is an extremely serious concern that directly impacts patient safety, which is my absolute top priority. My immediate action would be to observe and document the specific behaviors that lead me to this suspicion, focusing purely on objective, factual observations rather than making assumptions or judgments about the cause. This might include slurred speech, unsteady gait, unusual confusion, difficulty performing tasks, or an odor. Once I have clear, objective observations, I would not confront the colleague directly. Instead, I would immediately and discreetly report my concerns to my immediate supervisor, typically the charge nurse or nurse manager, as per hospital policy. I would relay my observations calmly and factually, explaining why these behaviors raise concerns about their ability to provide safe patient care. This is crucial because it initiates the proper internal process for addressing such sensitive issues, ensuring confidentiality and adherence to established protocols designed for both patient protection and colleague support. I understand that this is a difficult situation for everyone involved, but safeguarding patients is paramount. I would trust my supervisor to handle the situation appropriately, which usually involves removing the individual from patient care duties, conducting a confidential investigation, and guiding the colleague towards necessary support or intervention programs. My role is to act promptly and responsibly, ensuring the safety of patients and supporting a healthy work environment, while leaving the formal management of the situation to leadership.
You're assigned a task outside your expertise. What do you do?
When I'm assigned a task that falls outside my immediate expertise, my first step is always to clarify the expectations with the person who assigned it. I'd ask specific questions to understand the exact scope of the task, the desired outcome, and any deadlines involved. This ensures I fully grasp what needs to be achieved, even if the method isn't immediately clear to me. Once I have that clarity, I identify if it's a task where I can quickly acquire the necessary skills or knowledge. This might involve consulting relevant hospital policies or protocols, looking up evidence-based guidelines, or accessing reputable online resources. I'd also look for colleagues who possess that expertise and ask if they'd be willing to offer guidance or mentorship. Learning from experienced peers is invaluable. If, after this initial exploration, I determine that the task genuinely requires specialized knowledge or certification that I don't possess and cannot realistically acquire in the given time frame, I would transparently communicate this back to my supervisor. I'd explain what steps I've taken to understand the task, why I believe it's outside my current scope, and, if possible, suggest alternative solutions or colleagues who might be better suited for it. My priority is always to ensure the task is completed safely and competently, even if that means admitting I'm not the best person for it initially.
You're assigned a task outside your expertise. What do you do?
When disagreements arise with doctors or colleagues, my first step is always to prioritize patient safety and effective care. I approach the situation calmly and professionally, focusing on the issue at hand rather than personalities. My method involves initiating a private conversation to understand their perspective fully. I'd state my concern clearly and concisely, providing specific observations or evidence that led to my differing opinion. For instance, if it's a clinical disagreement, I might say, I wanted to discuss Mr. Smith's medication order. My understanding is that given his renal function, a lower dose might be more appropriate, as per our hospital guidelines. Could you clarify the rationale for this dose? This opens a dialogue based on clinical reasoning and evidence. My aim is to collaborate towards the best possible patient outcome. If we can't reach an agreement through discussion, and I still believe patient safety could be at risk, I would follow the established chain of command, escalating the concern to a charge nurse or supervisor. This ensures that the disagreement is addressed through appropriate channels and that the patient's well-being remains the central focus. I always maintain respect for my colleagues' professional judgment, even when we disagree, fostering an environment where open communication and mutual respect lead to optimal patient care.
A patient's family is angry about delayed treatment. How do you respond?
When a patient's family expresses anger about delayed treatment, my immediate priority is to respond with empathy and professionalism, acknowledging their distress rather than becoming defensive. I would approach them calmly, make eye contact, and start by saying something like, "I can see you're very upset, and I truly apologize for the distress and frustration this delay has caused you and your family. Your concerns are absolutely valid." After validating their feelings, I would then gently and transparently explain the situation, without making excuses. For instance, I might say, "Please understand that in the emergency department, we sometimes face unpredictable surges in patient acuity, meaning we prioritize care based on the most immediate life-threatening conditions. While we strive to see every patient as quickly as possible, unforeseen critical cases can sometimes cause delays that are unfortunately beyond our immediate control." Following this, I would immediately transition to a solution-oriented approach. I would assure them that their loved one's care remains a priority. I would offer to go and get an updated status on their family member's condition and the estimated time frame for treatment. I'd commit to relaying this information back to them as soon as I have it, and to continue providing regular updates. If appropriate and available, I might also offer practical comfort measures, like a blanket or a glass of water. My goal is to de-escalate their anger by demonstrating that I hear them, I care, and I am actively working to resolve the issue and keep them informed every step of the way.
Describe a time you advocated for a patient's needs against hospital policy.
In my previous role, I once cared for an elderly patient in the final stages of a terminal illness. Hospital policy mandated strict visiting hours, usually limiting family presence to specific daytime windows to ensure patient rest and reduce unit congestion. However, this particular patient's family, consisting of close children and grandchildren, expressed a profound need to be present around the clock, providing comfort and spending what precious little time remained with their loved one. They were naturally distressed by the idea of adhering to rigid visiting hours during such a sensitive period. My task was to balance the hospital's operational policy with the deeply human and psychological needs of both the patient and their family during an incredibly vulnerable time. I firmly believe in advocating for holistic patient care, which extends beyond medical treatment to encompass emotional and spiritual well-being. I didn't simply disregard the policy. Instead, I approached my charge nurse and explained the unique circumstances of the patient and the family's fervent wish. I articulated how allowing extended family presence, even just for a few key family members at a time, would significantly contribute to the patient's comfort and dignity and provide the family with closure. I also assured my charge nurse that the family was cooperative and understood the need to maintain a calm and quiet environment for other patients. My advocacy involved presenting a compassionate, yet reasoned, argument for an exception based on the patient's end-of-life status. Ultimately, we received approval for a flexible visiting arrangement, allowing family members to be with their loved one continuously, with a focus on respectful and quiet presence. This outcome significantly reduced the family's distress, promoting a more peaceful environment for their final moments together, and reinforced my commitment to patient-centered care.
How do you prioritize patient care when handling multiple critical cases simultaneously?
Prioritizing patient care when handling multiple critical cases simultaneously is a cornerstone of nursing practice, demanding a systematic and ethical approach. My strategy always begins with a rapid, yet comprehensive, assessment of each patient's immediate needs using established prioritization frameworks like the ABCs, airway, breathing, circulation, and Maslow's hierarchy of needs, alongside an evaluation of their acuity and stability. I quickly identify which patient's condition poses the most immediate threat to life or limb, as these are invariably the top priority, requiring immediate intervention. Following this initial assessment, I leverage effective communication and teamwork. I would immediately inform the charge nurse and other team members about the critical cases, delegating appropriate tasks to ensure all patients receive timely attention while I focus on the most unstable. For instance, a patient experiencing sudden respiratory distress would take precedence over a stable post-operative patient with mild pain, even if both require attention. Throughout this process, continuous reassessment is vital. Patient conditions can change rapidly, necessitating a flexible and dynamic approach to my prioritization. My aim is to stabilize the most critical, then methodically address the next urgent needs, all while ensuring ongoing monitoring and support for every patient under my care. This organized yet adaptable approach ensures patient safety remains paramount even in high-pressure situations.
Describe a time you made a mistake in patient care. How did you handle it?
In my career, I recall an instance early on where, while preparing a routine medication for a patient, I momentarily miscalculated a dosage during the reconstitution process. The situation involved preparing an intravenous antibiotic for a patient recovering from pneumonia. My responsibility was to ensure the correct concentration was meticulously prepared before administration. As I double-checked my calculations, which is always my standard practice, I immediately identified the slight discrepancy. I realized I had inadvertently pulled an incorrect volume from the diluent, which would have resulted in a slightly underdosed medication. Upon recognizing this error, my immediate action was to halt the preparation process completely. I did not proceed with the administration. Instead, I promptly informed my charge nurse about the mistake I had identified. Together, we reviewed the calculation and the preparation steps. We then properly discarded the incorrectly prepared medication and prepared a fresh dose from scratch, ensuring it was precisely accurate. I also completed an incident report, as per hospital policy, to document the error, even though it was caught before reaching the patient. This transparency is crucial for patient safety and for systemic learning. This experience reinforced the absolute necessity of every single double check, regardless of how routine a task may seem, and underscored the importance of an open, non-punitive reporting culture for continuous quality improvement in patient care.
How do you ensure accurate medication administration under pressure?
When it comes to administering medication, especially under pressure, my priority is always patient safety, which hinges on accuracy. I rely heavily on a systematic approach, specifically the 5 rights of medication administration: the right patient, right drug, right dose, right route, and right time. Even when things get hectic, I don't compromise on performing these checks for every single medication. I make it a point to minimize distractions as much as possible during medication preparation and administration. This might involve using a no-interruption zone, if available, or simply stepping away from a high-traffic area to focus. Before administering, I'll always double-check the physician's order against the medication label, and if there's any doubt or if the order seems unusual, I'll clarify with the prescribing doctor or a pharmacist immediately. In a high-pressure situation, I also find it helpful to verbalize my checks to myself or a colleague, which serves as an extra layer of verification. If the workload becomes truly overwhelming and I feel my ability to maintain accuracy is compromised, I don't hesitate to ask for assistance from a colleague or the charge nurse. It's far better to ask for help than to risk a medication error. My ultimate goal is to ensure every patient receives their medications safely and correctly, regardless of the surrounding demands.
Explain your experience with any latest advancements in healthcare.
My experience with the latest advancements in healthcare largely revolves around the increasing integration of telehealth and remote patient monitoring, RPM, into daily practice. In the past year, I've seen a significant shift, especially in managing patients with chronic conditions like heart failure and diabetes. Previously, monitoring these patients relied heavily on in-person clinic visits. Now, with RPM devices, we can track vital signs, glucose levels, and even activity patterns from afar. For example, I've been involved in onboarding patients to use Bluetooth-enabled blood pressure cuffs and glucose meters that automatically transmit data to our electronic health record. This allows me to receive real-time alerts if a patient's readings are trending dangerously, enabling us to intervene proactively, often through a quick telehealth consultation, before their condition worsens to the point of hospitalization. This has been transformative. I've personally seen how it empowers patients to take a more active role in managing their health, as they feel more connected to their care team and can see the immediate impact of their lifestyle choices on their readings. For us as healthcare providers, it means we can provide more continuous, personalized care, optimize medication regimens more efficiently and ultimately improve patient outcomes while reducing the burden of frequent clinic visits. It truly bridges the gap between hospital and home care, making healthcare more accessible and patient-centered.
How do you stay updated with medical advancements?
Staying updated with medical advancements is an absolute imperative in nursing, given the rapid evolution of healthcare knowledge and practices. I employ a multifaceted approach to ensure my knowledge base remains current and evidence-based. Firstly, I make it a habit to regularly read peer-reviewed nursing and medical journals relevant to my specialty, such as those focusing on critical care or chronic disease management. Subscribing to their email alerts helps me keep abreast of the latest research findings and clinical guidelines. Secondly, I actively participate in continuing education units, CUs, which are not only a professional requirement, but also invaluable opportunities to deepen my understanding of new treatments, technologies, and best practices. I frequently enroll in online modules and attend webinars offered by reputable organizations. Furthermore, I value in-service training and grand rounds provided by the hospital. These sessions often highlight specific advancements directly applicable to our patient population and provide a platform for interdisciplinary learning. I also make an effort to engage in discussions with physicians and other colleagues, as peer-to-peer learning and sharing of insights from diverse clinical experiences are incredibly enriching. Lastly, I leverage digital resources, utilizing reputable medical databases and professional nursing association websites to verify information and explore new advancements that can enhance the quality and safety of the patient care I provide. This continuous learning ensures I can always offer the most current and effective interventions.
Where do you see yourself in 5 years?
In 5 years, I see myself as a highly skilled and specialized nurse, likely having pursued further certifications in a specific area of interest, perhaps critical care or nursing education. I aim to be a resource person on my unit, someone colleagues can rely on for complex clinical questions or to mentor new staff. I envision myself actively contributing to quality improvement initiatives, perhaps leading a project focused on enhancing patient outcomes or streamlining a nursing process. Ultimately, I want to be in a role where I can continue to provide direct patient care while also influencing positive change within the healthcare system, whether that's through formal leadership, advanced practice, or specialized teaching. My goal is to continually grow professionally, contribute to a positive work environment, and ensure I'm always at the forefront of delivering excellent patient-centered care.
Where do you see yourself in 5 years?
In 5 years, I see myself as a highly skilled and specialized nurse, likely having pursued further certifications in a specific area of interest, perhaps critical care or nursing education. I aim to be a resource person on my unit, someone colleagues can rely on for complex clinical questions or to mentor new staff. I envision myself actively contributing to quality improvement initiatives, perhaps leading a project focused on enhancing patient outcomes or streamlining a nursing process. Ultimately, I want to be in a role where I can continue to provide direct patient care while also influencing positive change within the healthcare system, whether that's through formal leadership, advanced practice, or specialized teaching. My goal is to continually grow professionally, contribute to a positive work environment, and ensure I'm always at the forefront of delivering excellent patient-centered care.